have been directed to this video to show you how to safely remove wedges from your Aircast walker boot at home. Please use an assistant to reduce the number of wedges for you so that you can concentrate on keeping your toes pointing down whilst the boot is off. The outcome of your treatment is dependent on your compliance with these instructions, so please watch this whole video carefully before attempting. The first time you will remove wedges is after 4 weeks of treatment. At this stage, you should remove 2 wedges and wear the Aircast walker boot for a further 2 weeks. Finally, remove all the wedges so that your heel is completely flat in the boot for the final 2 weeks. This means you will wear the Aircast walker boot for a total of 8 weeks, and during this time, you must wear the boot at all times unless removing wedges. This includes sleeping. If you are at all unsure before removing your wedges, please contact us via the details at the end of this video. With the toes pointing down, the 2 ends of the torn Achilles tendon at the back of your ankle are in close contact, allowing the tendon to heal. If the toes come up suddenly, the 2 ends of the tendon are pulled apart. If this occurs, it is very likely that your tendon will not heal, and therefore you must concentrate on maintaining the foot position that is demonstrated in this video. After 4 weeks of treatment, you are ready to remove the first 2 wedges. In a seated position, carefully undo the 3 Velcro straps and fold the Velcro edges back to prevent them sticking to the inner sock. The plastic shell will then peel forwards to remove. Undo the Velcro at the front of the inner sock and slide your foot forwards. It is essential to keep your toes pointing down to the floor at this stage. Gently place your toes on the floor with the heel off the ground and hand the walker boot to your assistant. You must concentrate on maintaining this foot position until the boot is back on. You will also have a layer of stockingette covering your foot, which helps to protect the skin around the foot, but mainly at the heel. This has been removed in this video so you can see the foot position better. When the boot is removed, check that the stockingette is not wet or soiled. If it is, please remove the stockingette and inspect the skin over the whole foot, but in particular, paying attention to the heel to make sure that it has not become irritated. You will need an assistant so that you can concentrate on keeping the toes pointing down. In some circumstances, there may be a blister, and if this is the case, we would ask that you contact the Orthopedic Trauma Helpline for advice. If the stockingette remains dry and the heel is not sore, then simply recover your foot and proceed to reduce the wedges as shown. Remain seated whilst your assistant removes the inner sock from the walker boot. There will be 4 wedges stacked on top of each other, already inside the boot. Remove the top 2 wedges and then place these back in the heel end of the walker boot. The inner sock can then be replaced. Your assistant should place the walker boot on the floor in front of you. With your toes still pointing down, place your foot inside the boot, sliding the heel back until it touches the back of the boot. Fasten the inner sock using the Velcro, and then replace the outer plastic shell. The boot is then secured by fastening the 3 Velcro straps at the front. If you were provided with a stockingette, this should be on your foot before it is placed back into the walker boot. After 6 weeks in the walker boot, simply repeat these steps and remove the final 2 wedges so that your foot is completely flat in the boot for the last 2 weeks. At the end of treatment, you can simply return to a normal flat shoe, such as a trainer.